Hello, everyone. This is Dr. Neha Gupta from Giggles Clinics and my own space. So today let's talk about, how to prioritize the therapies. Whenever a child is diagnosed, you get some 5, 6 therapies on your prescription pad that you should get OT done, you should get ABA done, you should get speech done, special ed done, physical therapy done. But how to actually proceed for it? So I'm going to share few things that I have experienced and what I have seen over some years of my experience. So I hope, I would like to share that information with you. So whenever we start working with our child, first and foremost thing to look for is to go for occupational therapy and sensory integration therapy. So sensory integration forms the foundation for all your upcoming skills and for all your upcoming things. If that foundation is not solid, so the further building that you're going to build upon it will have a higher chance to crumble down. Crumble down doesn't mean that the child is going to lose the skills, but you will experience more of fluctuations, more of ups and downs. So first and foremost, you have to take care that you are taking your child for OT and sensory integration. It is not just the, some aspects of OT to be worked on. OT is very vast. So you need to work upon all the aspects. And if the sensory is not taken care of in the occupational therapy, then you will see that the child is probably lacking attention, or individually he is fine, but wherever you see a mixture of 2 to 3 stimuli happening, suppose in the public places, so a child is very good in the private place, so one-on-one therapy the child is performing very, very well. But as soon as you take the child to an external environment or with a new person, or in a social scenario, there you see that the child gets overwhelmed, or the child is behaving or showing behaviors and doing things which he doesn't normally do, and we don't know what is happening. So at that point of time, sensory overload is happening. Now, apart from the fact that you are getting the therapy done, another thing that is very, very important and we do not usually take into consideration because we are more scared of the behaviors the child is going to show in the public places or in the social scenarios. We do not take the child out very often, which is a big mistake. So exposure therapy is equally important. You should start taking your child to each and every place that you're going. Expose the child to different environments right from the beginning. See, when the child is small, 2 years, 3 years, even if he's crying or he's shouting, it is much more acceptable than a child who's crying or shouting when he is 6, 7, 8 years, right? So it is better that if we let the child do those things at the age of 2, 3, 4 and get settled by the time he is 6 or 7. And exposure therapy works wonders for sure. So the more you will expose. Now, the child, what the expectation happens, the child is settled in one-on-one therapy. His OT has said he doesn't need it anymore. Yes, according to him, yes, done. Because he is performing everything and we are seeing a proper integration happening in a closed environment. But as soon as the child goes to a social scenario, everything goes for a toss. So why is that happening? Because that integration has not happened for social scenarios or for public places. So you have to start giving exposure to the child. So we cannot expect suddenly that a 7-year-old, just because he's 7 years, will go out and settle down in a restaurant and start eating, or will not snatch food from somebody's plate, or will not push somebody in the line. So things like that happen, and then we are like, what is this happening? So you have to also start giving exposure right from the beginning. Take the child out and go in small steps. You don't want to take the child to the mall and we know for sure he's going to throw a tantrum. Fine, just go and take a round and come back. Then next time you go, take 2 rounds and come back. Increase the duration. If you want the child to go to the restaurant, then just first start with takeaways. Then take the child just outside the car. Then take the child near the door of the restaurant. Take the child inside and order takeaway. Take the child inside and order a short, quick meal, some ice cream or some snacks which will be served very quickly, then go on for an elaborate meal. Straight away, expecting that the child will go to the restaurant, sit there waiting, and then eating for some 45 minutes, 1 hour of duration of that meal is a little impractical for the child. Okay, so we have to start with the exposure therapy as well, which is highly underlooked, and often we start doing it late. Most of us, we start doing it late because first we are concentrating on the individual therapies, let the child settle down, let the child become used to it, then we will do it, then we will do it. And in that, because as special needs parents, it is so stressful for us to handle the initial diagnosis, handle the therapy stress, the financial things, a lot of other things, things in the family. But despite all that, we need to gather ourselves and think that social skills, the things that do not come in one day. So social skills have to be start building right from the beginning. So get your child exposed to those things. Now, when you have started OT, now comes the speech part. Let the child settle down a bit. So very many times we see that a 2.5-year-old child or a 3-year-old child, and as soon as he or she is diagnosed, he is enrolled into OT, speech, special ed, ABA, all the therapies at one go, and it is so stressful for the child. They do nothing at home. No matter how many therapies you're taking one, you're taking four, please make sure you're working with the child at home. And why is that? Because the child has to develop the rapport with you to work at home. He's not going to go for therapies lifelong, right? And we do not want to continue it for long. We eventually want to fade it off. Therapies are like supplements. They're not the main diet. Main diet will be provided by you. Therapies are going to give the supplement. So learn from there and implement at home. Talk to your therapist. Talk to them like, this is the problem. How should I solve it? But it's the prime role, the major thing or the major person working in the life of the child should be you as a parent. So once you are enrolled into OT and the child is settled a little bit, now proceed for speech therapy. Okay, now speech therapy, if the child has oromotor or articulation issues, if he has any speech clarity issues, if he has any feeding issues, please go for oral placement therapy or oromotor therapy. If the child does not have any of these, then go for the traditional language therapy, the communication therapy, where you will work on the receptive language as well as the expressive language of the child. Many a times we see that, many speech therapists are not trained in oromotor therapy. So you have to take special care of that thing, that if you're facing that problem in child, start working from it from an early stage. So by the time the child learns a pattern, so correcting a wrong placement or correcting a wrong pattern of saying is more difficult. So teaching the child right pattern right from the beginning is way easier, and the clarity comes side by side. Okay, so it's not that let the child first say the full sentence and then I will think of clarity. So you start working on it. Children who are having apraxia, you need to work on both the things together. So you have to take into consideration that point as well. Now, for the children who are having very less imitation skills, I found ABA especially useful there. But uh, again, you need to be very judicious about therapies, for how long you have to take it, for how what are the goals that are being done. It's not that initially you're getting very good results and then it is dragged. So you should get a continuous benefit from it. Not that I'm saying that you will achieve something in 1 month or 2 months, but yes, you can continuously see. And sometimes kids do get stuck on few things. It takes a long time for one or two concepts to for the child to get it, and don't worry, he will get it. Okay, so especially when it comes to imitation, instruction following, those skills are very well developed in ABA. The only problem that comes is the reinforcer dependence. So your therapist would know how to fade it off. Learn from your therapist how you can fade off the reinforcer dependency. Using the reinforcer in home scenario, I've seen it going very, very wrong many times. So what happens is, suppose the child wants to eat something and you have kept that piece of cookie after he says something or probably he performs the task. So what the child demands, first you give me the cookie and then I'm going to do the task. And you give in. You first give the cookie and then you ask the child to do the task, which probably doesn't happen. Okay, because one time he will do, second time he knows he just got what he wanted and he's not going to do the task or not going to complete the task. So using the reinforcer should be done very, very judiciously. And reinforcer fading should be done side by side. Otherwise, I've seen good children who had internal motivation getting dependent on reinforcers for work. Okay, so please do it side by side. At the same time, when you're working on the speech, start fading your prompts also side by side. So it becomes easier and it becomes easier for the child also to initiate the conversation. Although it is not pertaining to therapies, but I would still like to mention that when you're working with your child on speech, try to use more descriptions or more statements rather than questions. Okay. Now, by the time the child has some identifications, he has some sitting tolerance, he has some instruction following, he can take some command from someone else, sit for some good 15 minutes to 20 minutes, 30 minutes. Now you go in for the special education. Okay, bombarding all the therapies on the children is not a good idea. So keep adding and keep decreasing some. So if you were going for suppose 5 to 6 days to OT in a week, and then you see that the child is getting settled. So think that can I make it 4 now and add something here? Because not one therapy is going to solve everything. So you need a multifaceted approach. So think what can I take, and always keep substituting. So if you're taking the child off OT, then you need to incorporate some physical therapy wherein his excess energy can be drained. So put him into some sports or put him into some physical fitness session, put him into some dance lessons, dance sessions, where he can get that input to his body which is required for him to remain regulated. Okay. So when you are taking the child off the therapies, I will try to make a video on it, like how you can take the child off therapies. But you need to be thoughtful about how many hours of therapies is my child going to, how many hours am I going to put into my child, invest into my child, traveling time. So all these things should be taken into consideration. And you should prioritize therapies based on the needs of the child. Some children, they need OT for a longer duration of time than others. Some children, they need speech for a longer duration of time. So you have to see according to each child, what is required and what is not. Don't just think and don't just follow blindly that that child got benefited from this particular therapy, so I need to rush there. No, think. Okay, see what my child needs. Will that therapy will be useful for my child? And then advise. If a new parent comes to me and we do the diagnosis and then we're like, no, you need this. But we do not start 4 to 5 things at the same time. We start few things that can be started at the same time. Like we can start with OT, we can start with music intervention, or we can start with some dietary and supplemental modifications, the biomedical interventions. So we have to see what it is to be done. So just please don't go for everything at one time and make spaces. So if you're doing one, then gradually add second, then gradually add third, and start taking off the child so that the child will also have a certain number of hours that he is spending on therapies and not the whole day. So, and prioritize this thing that you need to work with your child as a parent. So I hope, this was my understanding and my experience of how you should prioritize your therapies. And first and foremost, you have to think for the sensory integration, the, ADLs, the activities of daily living, the behaviors have to be controlled. Now, yes, coming to the behavior therapy. So sometimes even 2 year, 3 year old child is enrolled into CBT. That is not meant for such a young child. So you have to think that what therapy my child needs. Behavior therapy, under behavior therapy also there are few categories. So which therapy you're going for, judge, ask what the therapist is going to do under this particular therapy, and how my child is supposed to benefit from, and make space, prioritize. Is academics the priority? Is physical the priority? Is language the priority? And go by the goals. So first thing, the child should be settled. His sensory system should be normalized. Not normal, but normalized, because that's a range. Okay. Then he should be able to communicate. Then he should be able to uh, he should be behaviorally settled, and he should do his work independently. So activities of daily living. And then you go in for the academic part of it. So for the younger children, always focus more on the physical aspect. Physical is like one very ignored aspect. And if the child is physically fit, if the child's body controls, body supports the child, you will automatically see that he is performing better in other areas as well. Cognitive development is better, academics is better. So by priority going, so go in for first sensory integration, go in for the language skills or the communication skills, go in for the behavioral settlement, go in for the activities of daily living, go for good gross motor, fine motor skills, and then proceed to the academic part. So I hope this will help you think and decide as in how to go in for therapies and what would benefit your child. Take suggestions from everybody, but think what will benefit my child. Is it suitable for my child? Do I need to introduce it at this time? Do I need to make space, reduce one class from there and put one class from here? So think about it, how you need to plan out. But don't think that, if I don't do it all together at one time, sometimes it gets very overwhelming for the child. But then again, each child is different and you need to see according to the child. So wherever there's a confusion, ask your therapist why we are doing this, how long do we need to do this. Long nobody can define, but just an approximate idea that what are the core issues to understand whether it's going to take a longer time or it's not much time taking. Okay, but like this therapy is the ASD part is a long period thing. So that is why go in the therapies, learn from them. Your therapist will be more than happy to teach you, more than happy to tell you why they're doing certain things. Keep learning from them so that you can also start implementing few things at home and accordingly prioritize. Okay. So I hope this information might help you and have a very good. Thank you.